irrigation, and then we're also going to do the dressing change. So we need to gather our supplies. So I've got something to measure with. I've got my cotton tipped applicators for measuring. I've got my swab to collect my sample. And I've got my lab bag. I've got my piston and container for irrigation. I've got my saline for irrigation. And I've got an extra absorbent pad to collect the saline for this process. And then I've got my dressing tray for doing the dressing change afterward. This red bag is in your sterile kit. So just pull that out of your sterile kit so that you have a red bag to use to remove the dressing. So before we start this process, we would wash our hands with hand sanitizer. We would put on our gown. So we want to protect ourselves. This is going to cause splashing. And then we are going to use just clean gloves at first. So I've done hand sanitizer. I'm putting on clean gloves, and I'm going to remove the old dressing. And when you're taking this off, you can see the date and time of the initial, like the person who did it before you. So you can see how long ago it was done. And then when you're taking off the tape, you just want to be cautious because it can irritate their skin when the tape is being removed. Okay. And then you're going to look at it to see if there's any drainage on the dressing itself. And then when you're removing the gauze pads, it's helpful sometimes to pay attention to how many you removed so you know how many approximately to pack back in. So I've got 1, and we're also looking at any drainage. 1, 2, 3. Okay, so that's what was removed. And now I'm going to take off my gloves. By the way, don't put extra trash in the red bags. This is for biohazardous material. Like if I'm opening up stuff, I'm going to put that in the trash can because these are usually weighed, and when they're disposed of, it's by weight. So you don't need to put extra stuff in. Okay, then I'm going to do hand sanitizer. And what's my next step? Before I irrigate, I'm first going to measure. I could do the irrigation first, but I'm going to measure first. This is just clean. They're not sterile gloves. When you have a measuring tape, you can see that it's in inches on one side and it's on millimeters on the other side. So if we take millimeters and centimeters, how many millimeters are in 1 centimeter? Just remember, you just move that decimal point over. So there's 10 millimeters in 1 centimeter. So the distance from that first line to the 10 is 1 centimeter or 10 millimeters. And we tend to measure in centimeters. I'm just going to rip my tape because I know I don't need it to be that long. So I'm going to set that there. And these are sterile cotton tipped applicators. So if I want to set this one down, I can, and just use this. So the first distance is length. How do I measure length? Is it the longest point? Nope, it's from head to toe. Okay, so the patient's head is here, their toes are down here. So we're going to measure the longest distance here. Can you see what I'm doing here? So measuring the outer surface from the head to the toe lower surface. And then I'm going to take my fingers at the edges and I'm going to go on my tape and I'm going to look how long that is. And that's about 5 centimeters. So the length is 5 centimeters. If you want, you can use your pen And you can write it down. So you can just use your little paper. Length 5 centimeters. Okay, and then what's the width? Yep, so from side to side. So where's our longest distance? Looks like about there. And then again, I go on my tape. I'm not touching my tape, I'm just hovering over it. And again, that's about 5 centimeters. So it goes to that 50 or 5 centimeters. So then that's the width, 5 centimeters. And then what's the other direction I need to measure? Depth. So then the deepest part. Now I want to point out there's a tunnel here, and there's also some undermining here. So I have to also include those. But for depth, you just go the deepest part. Looks like the deepest part is about where my cotton is on my applicator. So that is 1 centimeter. So length, width, depth, 1 centimeter. And then if I want to get this tunneling, let's see how deep that is. That's also about as deep as my cotton. And how do I determine, or document, I should say, where that location is? Do you remember the clock? Okay. So if we're looking at a clock, this is 12 o'clock, 6 o'clock. So what's this position?
7.
Yeah, one of my students, I remember, said 7:30. Because it's kind of between 7 and 8. So, but yeah, like 7 o'clock. So 1 centimeter at 7 o'clock position. And then we've got this undermining. So the deepest point here is just a little bit longer. It's about 1.5. So 1.5 centimeters at what time are we looking at here? So if this is 6, goes to about here. So if we're looking at a clock, what does that look like?
It's 1.
Maybe 2 o'clock? Can you see how that could be like
Yeah.
2 o'clock? And then if we go over to this position,
But isn't it the opposite though? The head is 12, right?
the head is 12. Yep.
So the head is 1.
So I went over to the right first, and that's at the, come over this way, maybe you can see better. So if I'm at this position, that's like at the 2 o'clock until the what position?
I thought the head is this side.
So about the 10 to 2. So from the 10 to 2 o'clock, we've got 1.5 centimeters. Okay, so all my measuring is done. Discard that. Throw that away. Okay. Now, do I culture my wound, or what do I need to do next?
Irrigating.
Next, I need to irrigate. When you open up an irrigation system, it will be in a sterile package. So you open up your package and you take this out. And you're going to look at your solution. What kind of solution do we use when we're irrigating?
Sodium chloride.
Sodium chloride or normal saline. I'm going to put my PPE on. Hopefully I'll talk loud enough you can hear. Okay, so I'm looking at what solution I have and when it expires. And I'm just going to pour some off. And now I'm just going to take out my syringe and pour in solution. Double check what I've got again. Then put my piston in. Do you remember how much solution, or how we know how much to use? Do you remember?
60 to 120.
60 to 120 mils, or until it runs clear. Okay, so if there's any bloody drainage or something like that, we want to wait till it runs clear. 1 syringe full, if you can get it all the way full, that's 60 mils. I have kind of small hands and I can get a full 60 mils, but if your hands are kind of too small, you don't have to fill it all the way. You can go a little bit shorter and that's fine. Okay, I don't want to ruin all my numbers. Let's see if we can catch some of the drips with some ABD pad. The blue is what goes to the outside, so I'm just going to kind of take this and try to catch any solution. This happens to be on the side of the patient. If it was like on their backside, you'd have them rotate. And actually, Salam, do you mind folding this up a little bit for me? Okay. And then we want to just irrigate all of this area. Can you see when you're there? Can you see what I'm doing while I'm doing this?
No, that's okay.
You can set it down. I want you.
Oh, okay.
All right. So we're just gonna squirt all of this area here until it runs clear, or until we get that 60 mils. Okay. And now, actually, I might need one more helper. Can someone grab me a 4x4? Okay, so we want to keep this as sterile as possible. If you take the corners of it and pull them together, I haven't touched any of this section, so I have clean gloves on, but I just want to dab off the excess fluid. So I'm just going to gently touch inside of that wound so that I can culture it. Now, when I'm culturing, what area can I culture? What kind of tissue? So you see what's going on in this wound?
On the red one?
The red one, yes. We want to use red granulated tissue. When you open up these packages, there's a cap. You have to remove the cap. Otherwise, when you put in your cotton tip or your swab, it will hit that, and then you'll have to get a different swab. So you remove the cap. I don't know why these have two. I'm just going to pull one off. Okay. Then I need to collect some cells on my applicator. So I'm just going to twist it a little bit and just kind of rotate it on the granulated tissue just to collect some of those cells for my sample. Okay. And then I just carefully put it back into my container. And now what do I have to do to my vial? I have to label it. So this would go in the trash. This particular style has like a sponge on the bottom. Sometimes there's like a hard thing that you have to squeeze and then it makes it a liquid. And because you just want this to stay moist for it to go to lab. So on your device itself, you're going to write the two identifiers, so your patient's name and date of birth. Oftentimes they'll have a patient label, which has their MRN number, something like that. So you're going to stick that on here, and then you're going to write your initials, the date and time that you did the collection, and what else?
Which location?
What location? Especially if your patient has multiple wounds, you're going to put, on this one, you would maybe put the left trochanter area. So that way you would know what specific area this culture was taken from. Then once this is labeled on the device itself, not just on the bag, because if the lab receives a sample without it labeled and only labeled on the bag, they will not run the sample. That's just wasted. So then you would either put this in the refrigerator or get this down to the lab if you have a lab on premise. Okay? Any questions with collection?
Do you also label the bag?
It depends on your facility. Some facilities want a label. Sometimes they put like a little piece of paper. There's like a little pocket. You put a piece of paper in there. Just so where you work, they might have a policy on how to do that. Okay. Now that I'm done, I'm going to just discard this. I would normally remove this as well. I'm just going to continue moving forward for you guys. And I can take off my face shield because there's no more splashing. Thank you. All right, so we've already done our measuring. If we are going to now do our dressing, so I'm gonna move this aside. Okay, so we've wiped down the table already. We've checked our bag. We know or our package. It says dressing tray. It says all the items that are in our package. It says our expiration date. And if it looks like it's intact and it has all the things that I need, that's great. If there's anything extra, I would grab those supplies. So then I can take out my package. And when we open up things, we always go away from us, and then side to side, and then toward us. I'm just gonna rotate my package a little bit. Just touching the border. I'm gonna pull out my gloves without touching out anything else in the inside of it. And I'm going to be pouring liquid. So I'm going to just pick up one of my gloves. So I'm going to put it on my non-dominant hand. When you're putting on your gloves, be in the habit of putting your hands up, because when you put them down, it's possible that your loose fingers will touch the edge of your paper or something like that and contaminate your gloves. There is an option for a sterile drape if you need extra sterile space. I'm not going to use this particular product. Just set it aside. And then I'm going to move my tray just like this. Let's take out my contents. If it's a large wound, you can take and unravel the Curlex. Like for this wound here, you might want to just unravel that Curlex back and forth and then cut it off with your scissors. So that's an option. Set that out. All right, so now I don't have to take everything out of my kit. That's okay. But now I'm just going to take my saline and put the lid back on, verify what I have. Pour off my solution. And I'm just going to use 2 bins just because if I need more, then I've got it. Okay, so now I'm going to put on my second glove. Okay. Now I have 2 sterile gloved hands and I can get to my patient's wound, but first I'm going to prep my dressings. If you fluff them, kind of take them out like this, and then put them in your solution, it's easier to fluff them when they're dry than once they're wet. And by fluffing, it just helps to get a little more surface area to get some of those dead skin cell or dead cells in the wound removed with debridement. If you're ever taking out a dressing from a patient's wound and it's dry or it's sticking, you have to get it wet with saline. Don't just pull it out, because if you do, you're going to remove some of the good cell growth and damage their wound. So we don't want to do that, and it will hurt them. There are tweezers or forceps that you can use if you want to. Okay. And you want your gauze to be wet but not dripping. Okay. Do you know where I'm going to start? I'm going to start on either the undermining or in the tunneling. And I want to be mindful not to touch my gauze to the external skin when I'm doing my dressing change. Okay. So if you prefer to use your forceps, you can use that to hold your gauze, but I don't want to see anybody using forceps to tuck this gauze, okay? Always use something soft like the cotton tipped applicator when you're all right. That looks like it's covered inside. I can throw that away.
How many gauze do you use?
I think I used 1, 2, 3, 4. I used at least 4, I think. Did you think I did 4? If you want to, you can cover with a dry gauze and then your ABD. That's personal preference. That's okay. The blue line always goes out, and you just want to cover it. If I put it like this, I would have to tape over my other wound, or I could fold it a little bit if I wanted to. Otherwise, I'm just going to position it over here. And now I'm going to tape. I don't have to remain sterile once it's covered like this. I'm just going to take my tape. And this rips pretty easily. You just have to push it. Sometimes it doesn't stick to the mannequin skin very well, but do your best. And you want to make a window around your dressing. So I would tape this part onto my patient's body. So taping that down too, okay? And then when I'm done with that, what do I need to do with my dressing?
Your initial.
Yep. Initial date and time. So don't sign on your patient. Just sign on a piece of tape. And so it's 11:04 today. And what's the time? The military time.
1500.
15.
It's not quite 1500. So what time is it? 14:55. So we always use military time. So if it's 11, it's 11 in the daytime. It's not 11 at night. What if it's 11 at night? What would we put? 2300. Yep. Okay. And you just stick that on there. And then it's labeled so the next nurse knows when that was done. And you should also document in the patient's record that you did the dressing change. If there was any drainage, if there is red drainage, how would you describe that drainage? Sanguinous. What if it was yellow? Serous. And what if it's a pinkish color? Serosanguinous. Purulent is when it's more of an infected kind of drainage. So it might be smelly, it might be thick, it might be milky, maybe brown, green, white. So something a little more uncommon is purulent, just to clarify that. Okay. Then I would take off my gloves, perform hand hygiene, clean up all my supplies. And also when I'm documenting, I'm going to document the size that I've measured on my patients as well. And I have demonstrations of how to do charting for wound care. And I want you guys to practice doing that charting on your progress note. If you need another one, I'll give you another one. Just so that we can see how you're doing with it. So we can give you feedback what you maybe need to do. I did not ask the patient for pain medication. That's something you should always do before you do a wound change, is ask if they need pain medication. Do you remember how much time ahead of the dressing you should do that?
30 minutes.
About 30 minutes. So if the patient needs some pain medication before the dressing, you would try to medicate that patient like 30 minutes ahead of time before doing the dressing change. Okay? Thanks.